Otherwise, the questions which were there from pulmonary medicine itself were very well covered in the test series or the videos. So I think speed played a big role in that. And mostly, sir, the way I used it was I did my questions first and I identified the parts in which I was bad at. And I went back to the question series, the question banks or the notes, and I studied those topics again.
I bring
That's
in
it.
all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Anay Kodape for scoring rank number 12 AML in DM Pulmonary Medicine in NEET session November 2025. Congratulations to you, doctor.
Thank you, sir.
And can we know a brief background about where you started till date, what all you have done?
Okay, sir. So I did my MBBS from AIMS Raipur itself. I am a resident of Bhopal. So after that, I went on to do my MD Respiratory Medicine from MGM Medical College in Indore. And currently, I am a senior resident posted in Gandhi Medical College, Bhopal.
Excellent. Great accomplishment and wonderful to
Thank you.
know it. And can we know why your pulmonary medicine was your primary interest? Then when you decided to do a DM pulmonology, can we know about the interest that you had for pulmonology?
So sir, from choosing my MD subject itself, it was always about finding a niche for myself, always specializing in a topic rather than having a general idea about things. So pulmonary medicine was a interest for me from the start itself. And after I did my MD respiratory medicine, I felt that uh, I'm more interested in studying more about the academics as well as exploring like subjects like intervention, sleep medicine, allergy. So therefore, I thought that if I invest 3 years more into my academics, I would probably learn more about things and be better ready, better equipped to help the patients.
Great, doctor. Nice to know about that. And can we know once you decided to do a DM pulmonology, when did you start your preparation? Can you tell us something on your preparation strategy that helped you to achieve what you're today?
Sir, last July session, I also gave the last July session, although I was not much prepared for it. I was busy elsewhere, but then I had gotten a rank of 32, AML 32 in the last session. So I felt that there is not a very big lacuna which I have to cover. So I felt that the next 6 months I should invest in giving tests and watching some more videos. And 6 months after 6 months, I gave this exam and got a rank of 12.
Okay, how many hours you prepare per day? Is a full-time preparation or part-time preparation? What all videos watched? What? How much of GTs you gave? What are the tests and what are the practices you want to make?
So, sir, I would say that as a senior resident, it was not possible to invest all the day in it. So, I would say probably 2 years, sorry, 2 hours every day is how much I invested. And mostly I was focusing on the high yield videos which are put on by mostly Hariharan sir and Pahuja sir. So, a lot of topics which I had already studied, like for example, in Fishman's or some guidelines, but it was not comprehensive, I would say. But when I watched those videos, topics like pulmonary embolism, interventional pulmonology, and pulmonary artery hypertension, etc. There are like 6 to 7 videos which they have covered in a high yield series. So those videos I watched full, and also the notes which are given along with those videos. I think I studied those notes for 4 to 5 times during my preparation. And questions, I think I covered all the questions which are given. I did the entire QBank which was there. And a big shout out to the test series, sir. The INI pulmonology test series, which I used to give every Sunday, I would say. And I had given approximately 6 or 7 GTs in the past 6 months. And from those mistakes, especially the medicine part, which was weak for me, so I tried to identify those systems which were weak for me, and I went back to my notes and I studied them. So that the test series was a very important factor for me, sir.
Great. Now, who introduced speed to you, got to know from, and what was your experience of that input?
So, sir, I got to know about speed. Like, I had heard it from everywhere during my PG days as well. My seniors were the ones who introduced me. I contacted my seniors who had cleared DM exam, and they all recommended me just speed. They told that speed is, the solution. So you should invest in speed, and you should give the test series as well as see all the videos. So I got to know about that. And mostly, sir, the way I used it was I did my questions first and I identified the parts and which I was bad at. And I went back to the question series, the question banks or the notes, and I studied those topics again.
Great. Now, can you share how many questions did you answer in the exam and what was the paper or mostly asking to, how we prepare for the interview and what were the interview parts?
So, sir, regarding the theory exam, I just left out two questions which I had no clue about, but 78 out of 80 questions I attempted. And mostly I felt that this time medicine part was a bit, I would say, friendly for pulmonary medicine people. So, yeah. So, otherwise, the questions which were there from pulmonary medicine itself were very well covered in the test series or the videos. So, I think speed played a big role in that. In the interview itself, so last time they had asked me interventional critical care, interventional pulmonology, and also I was prepared for that. But this time it was mostly about the pulmonary function test and the new guidelines which have come up. And a few of them I could recall through my the videos I had watched or the questions I had seen. So I think the interview preparation video was there, which was put up by Deepak Pahuja sir. And also there is a live session one day before the interview, so I had attended that session as well. So yeah, he advised that they won't be able to judge your knowledge entirely in 10 minutes, but whatever they ask, just have a presence of mind and say whatever you know about the topic. That's it.
Very nice. Now, what is that advice that you want to give for the future aspirants of DM pulmonology?
Sir, my advice would be to build a solid foundation base. I would say if you have time, you should watch the videos and especially the cases which you get to see in the ward. I would say come back and read them, and then slowly build your base. And only when your base is built, you know all the basics of each topic. Only then you should try to do the questions and see how much you know. That's it.
Great, great to know. Now, time to thank and whom all you want to thank. They helped you, stood by you to build your career till date.
So, sir, most of all, I would like to thank my family, my parents, my sister, my wife, and all the other family members, my department from Indore and Bhopal, and also my seniors who guided me to how to study, where to study from, what not to study, and the juniors who kept asking all the questions. And, therefore, I would also go back and read all the notes and let them know the answers.
Great, great, wonderful. So, once again, on behalf of Speed and faculties of Speed, I wish you all the very best and all the success for a great and wonderful career in DM pulmonology. Best
Thank
wishes.
you, sir. Thank you so much.